Good morning. Welcome and thank you for joining us for week 10 of our Northern Light Health Business to Business Zoom conference. Today, we're continuing our special editions with a business to business conversation. Four main business leaders join us to share their COVID-19 experiences. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. The past 5 months have been some of the most challenging times probably all of us can remember. I think it is safe to say that Maine businesses across the state have been struggling with closing, struggling with reopening, and struggling with staying open. The rules and guidelines are frequently changing and vary based on services and products that businesses offer. To stay open, businesses had to adhere to new safety measures, all new to everyone. Closing caused all sorts of challenges. We even saw some businesses completely transition their product and develop a new one to help meet the demand of inadequate personal protective equipment supplies. It's been quite a ride for everyone. I have to say, in it together sounds real, not just some spin. Today, we're going to probe into the details and find out more about the ingenuity Maine businesses apply. And we'll look at the emotional and financial demands required to keep our doors collectively open for business. I'm pleased to introduce you to our panelists today, who are Carrie Mayo. Carrie is the CEO of Anthony John's Day Spa and Boutique, and she's also the Vice President of Fixed Operations at Darling's Auto Group. Tasha Gardner is the Chief Financial Officer at Sargent Corporation. Ryan Albert is the Senior Vice President and Director of Human Resources and Employee Development at Bangor Savings Bank. Scott Bine is the President and CEO of Intention, a manufacturing company. And rounding out our panel is Jeff Doran, our Vice President of Northern Light Medical Group and our COVID Response Incident Commander. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. In regard to employment, every situation is unique and must be reviewed on a case-by-case basis to ensure compliance with the law. The information presented should not be taken as legal advice, and you will need to retain your own counsel to review specific questions regarding employment situations and/or accommodations in your organization. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. So, this hour is for you. Let's make it a two-way conversation. Anytime you have a question, please use the chat function. I'll keep track of your questions and have our panelists respond. Also, to help us get a little more detail on how we can best support your efforts, we're going to email a 5-question survey following our Zoom conference today. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in us focusing on in the future. Let's get started. First, we'll have our panelists share a bit about their businesses and some of their experiences. After you've had a chance to meet our panelists, we'll have a roundtable discussion to address your questions. First, Carrie, thank you for joining us. Tell us about your two businesses and the different ways you had to approach COVID-19. First, Darling's Auto Group.
Thank you for having me. At Darling's Auto Group, most of us were all considered essential. The only department that kind of went back and forth was our sales department, whether actually in March it was considered essential, and then April it was not considered essential, and then it came back and was essential in May. Some of the things that everybody did was follow a lot of the PPE requirements, the 6 space, keeping the mask, things like that. But some of our bigger challenges were, in April when a lot of the staff had to go either home, or what we did is we did split shifts. We created an A team and a B team. We reduced their hours to 30 hours. We took advantage of the work share program in order to help with income for some of the staff that had had their hours reduced considerably. Those were some good ways that we helped with combating some of the financial burdens that the staff would have, as well as the company would have. We took a look at a lot of our expenses. We worked on our communication, making sure that we were communicating. We did either video, emails, or a Facebook group with our employees and our customers. We created a online call at noontime with all of our managers to talk about what was going on at the dealerships, as well as how things were being handled or what things need to be adjusted or changed. During that time, while we were in the transition, especially in the month of April, we also created a lot of pickup and delivery services. Anything we could do that was contactless service or sales, we created any way that we could communicate and work with our customers during that period. We actually are very fortunate that Maine has a Maine Auto Dealers as an association here in the state of Maine that's very strong, and they were very helpful with us and with many of the other dealerships in the area in order to help kind of guide us through a lot of this. So that was a really a great benefit that we have, is having a very strong association. Several of our employees pitched in and created and did masks. They're either their spouses or them. We had several people make masks for the cloth masks for a lot of the employees that were still working, and as well as when a lot of the other employees returned back to work. On the spa side, it was a little bit different. It was a little bit more challenging. It's been, there isn't an association there at all. So it was really kind of more grassroots and trying to learn as you go with what we could do and what we couldn't do. And pretty much it was considered non-essential. So we've been closed since March 17th. We closed down all of our departments, and then slowly we're able to open up in stages. One of the things that we did in the month of April is really take advantage of that time, and we had multiple calls, team calls, as well as using a product called Slack, which helped us keep communication with all of our staff, as well as the management team, working on how we can make improvements going forward. What could we do, with when we reopen, what purchases we should be being made right now, so that when we open, that we have the supplies for it. That was a lot of the things that we did. One of the things that is still happening today is that we are still not open for facials and a lot of the skincare services, anything that has to do with removing the mask. So we can't do any facials, waxing around the lip and mouth area, makeup, as well as beard trims and stuff like that. So that's still been a challenge for us. Because several of that area was a revenue source for us that is still not being able to be created. And I have 4 staff members that's what they specialize in. So it's been a challenge trying to keep them busy and with other different services in order to help keep them busy. Some of them have a license in another area, so they've taken on some of the other responsibilities of whether they do nails now or they do a little bit of cosmetology at the time. Again, with the spa, the great thing was the team really pulled together. Actually at both locations, the teams have really pulled together and are continuing to pull together and do what we can to do. I would say for the spa, the biggest thing was the PPP loan was huge for us. That's probably the one thing that, that really kept us alive. So that's a little bit what's going on at Anthony Johns and Darlings. Ed, I think you're on mute still.
You want me to just roll into what we've had going on?
No, she's correct. I was on mute. So you think I would learn by now. Tasha, so the Sargent Corporation was considered essential throughout our pandemic. Please share with us the demographics of your business.
Yeah, well, yeah, it's a pleasure to be here today. So thank you very much for inviting us to participate. We're a large earth moving and site preparation company. We do large infrastructure projects, airports, heavy highway, turnpike projects. So we were considered essential throughout. However, it wasn't always obvious. So we have 400 employees, and we're located in the state of Maine, New Hampshire, and Virginia. And we have job sites throughout those states. So one of the things that we struggled with was there were different executive orders from different municipalities. So the state of Maine might have an executive order, but then the city of Bangor had something different. So we were constantly stepping and fetching and figuring out where our projects were and if they met the different definitions that we're rolling out as to what was essential. Generally speaking, we were able to continue to operate on all job sites. We did have one job site that shut down because the GC wanted to, not because we had to. So they took a 2-week break. It happened to fall during that particular project shut down in late March, early April, which tends to be a slower time for us anyway. But I would say some of the bigger challenges we had was finding the PPE that we needed for our people to work safely. We're fortunate in that we work outside, so we can have fresh air and generally can be separated from one another, but there are times you need to be close. And we very quickly gave our stock of N95 masks to the local ambulance service, but then that left us with no face coverings for our staff. So we hired a couple of people to scour and find soap, and couldn't find hand sanitizer. We built our own wash stations to have on every job site. And actually, Intention is going to be speaking soon, and they were a huge help to us. They very quickly got our folks face coverings that they could use on the job site. We switched to single occupancy because our crews travel. We also, like Carrie, we really leaned on our industry associations, and we also had a national law firm that helped us keep tabs on the different municipalities where our job sites were located. And we greatly stepped up communication. And we started a weekly podcast where we shared information about what we were doing and how we were reacting. And we picked up a texting platform so we could quickly text info out to all of our people, because geographically our folks are everywhere. So that really creates a challenge to communicate quickly with people. And sometimes they don't even have access to the internet based on where their job sites are located. We have a monthly newsletter. We switched to mini weekly newsletters. We just really started to communicate as much as we can. But we've been very fortunate. In the office, we did send a lot of our people home to work, which is something we never thought we could do. We never thought we could process payroll off-site, but we've been able to successfully transition to that. And we also had some struggles with childcare. Either the daycares were closed for the little ones, or with school being out, it put a lot of pressure on people to try to both work and also manage their children's learning. And for that, we basically just transitioned into trying to be just super flexible. But that's, in a nutshell, what we've been through.
Great. Well, thanks, Tasha. Ryan, no one would dispute banking as a necessity. You had to keep your doors open, but it wasn't business as usual. Please share with us the number of locations, services, and employees you had to transition on a dime.
Thank you, Dr. Gilkey. Good morning, everyone. So certainly a pleasure to be here. Yeah, it's definitely been a challenging year. I think that goes without saying. Frankly, an unprecedented year at Bangor Savings Bank that has required us to throw away the playbook and just become extremely agile. We've always admittedly been laggards in allowing folks to work from home. And really that's strategic for us. We put a great emphasis on our culture here at Bangor Savings Bank. And we truly believe our culture is stronger because our 1,000+ employees go to the office each and every day. They interact with each other. They collaborate with each other. We think that's so important for our culture at Bangor Savings Bank. But as we know, COVID happened, and on March 18th, we had to pivot and send 650 of our employees to work from home. Before COVID, we only had about 5% of our employees that worked from home. So to go from 5% to 65% overnight, that was a big deal for us. All Bangor Savings Bank employees have portable computers, either slates or surfaces. So the transition technologically was fairly seamless. We did have some issues early on, things such as lack of high-speed internet in some parts of rural Maine, et cetera. But overall, the transition went pretty smoothly. For those folks that couldn't work from home, we had to find a way to ensure the safety and well-being of our employees, which we all know that's always priority one, is keeping your employees safe, and balancing that with serving the needs of our awesome customers and communities. So that was something we had to balance and consider in all of our decisions. So at the start, we closed branch lobbies. We switched our branches to drive-up service only, which allowed us to send a few more branch folks home. We implemented all of the safety precautions, closely followed Maine and federal CDC guidelines. So face coverings are required everywhere, social distancing policies. We increased sanitization and cleaning schedules, put up plexiglass barriers and distance dots in branches. And there's hand sanitizer everywhere. I don't think you can go 5 feet at Bangor Savings without seeing hand sanitizer. And for those working from home, we found out early on that constant communication between our leadership team, our management team, and our employees was truly, truly crucial. We found out that folks working from home, they don't need to be micromanaged. We all have good employees and they're going to be totally productive working from home without being micromanaged. But they do need to feel constantly informed and constantly connected in order to stay engaged and motivated and productive. So we found out pretty early on how important that was. And so some things we did to help with communication, we implemented daily Zoom or Skype check-ins with managers. Our CEO holds bank-wide calls twice a week, which have been very well received. And one thing that I thought was pretty special and pretty important was that on his very first call to the entire bank, so 1,050 people on the line, our CEO said, no matter what happens throughout the pandemic, you have my word that we will not lay off a single person and we will not reduce anyone's hours. So as you can imagine, employees and families, when COVID hit and even now, there's so much to worry about already. It was really nice that employees didn't have to worry about their job security. So I thought that was pretty special. So for us over the past few months, it's been about slowly transitioning back to our new normal. And I put that in quotes. I think just like after 9/11, it's business as usual is going to look different here in the future. So for us, it's trying to find out what that new normal is, whatever that looks like. So recently we've reopened branch lobbies with strict safety protocols in place. We're trying to get those 650 employees at our home back into the office. We've done that by dividing our employee base into 2 groups, Group A and Group B, to help with social distancing and in case there is any kind of, widespread exposure. We've always have half of our workforce, working from home. And they'll rotate 2 weeks in the office and then 2 weeks at home and keep rotating like that on A and B. So we're hoping that works pretty well. I think overall employees have welcomed the opportunity to return to the office. Again, some have been home since March 18th. And, to see their faces when they walk in and see their colleagues, I think is pretty special. Obviously, some have some anxiety, which is understandable. And now that schools are announcing their reopening plans, naturally, we have lots of employees with major concerns about childcare, and I'm sure many of you on this call share those same concerns. So that's certainly a challenge that we're going to work through here in the very near future. But we're going to continue to be as flexible as we can, continue to support our employees and our customers as best we can throughout this pandemic. So thank you.
Great, thanks, Ryan. And I don't know, maybe somebody can promise us that there will be something that looks like normal again pretty soon. But anyway, thanks. Next up, Scott, you reinvented your manufacturing company and turned it into an essential business. Tell us about Intention.
Hello, how's everybody doing today? So Intention is a manufacturer of exhibits for trade shows, for museums, permanent environments. We build everything from the ground up. So everything you see in those photos right there is us. Our primary focus in the trade show, seminars, and museums pretty much shut down and kind of come to a close. So very similar to Anthony John's, where our industry kind of just shrunk and is on hold right now. We had to transition pretty fast. And because we have a pretty unique crew, we have a lot of manufacturing capabilities, from fabrication of metals, from fabrication of fabrics. It kind of led well into what we wanted to achieve with PPE. We were pretty adamant that we knew we could achieve the transition. It was just a matter of working the details out with those that would be in need, which in this case was quite obvious that there were many that were in need. So for us, our industry started to probably shut down late February, early March. We started to get quite a bit of information, excuse me, that different shows were paying attention to what was going on with COVID. And so around this time, as shows started to dwindle down, we started to put a lot of focus on how we were going to transition into that. And we started to organize immediately. We started to collectively talk internally, who was going to be, who was in, who was out, who needed help. And as policies started to come down from at the state level, as far as being essential or non-essential, and schools started to shut down, it put quite a bit of stress on us. We're not the hugest company in the world, but we're 50 plus employees. So you take 50 families, you put them in strenuous situations where they're gonna need each other as a family, but they're also gonna need the place where they work, and they have to be able to rely on it. So collectively, I'm pretty proud of what our administrative level and our employee level were able to really come together and figure out, all right, who can help here now, who can help later on. And so what we did is, currently right now, it was about 10% of our workforce work from home. And those individuals are still working from home. We haven't had anybody transition into that home arena where they're working from home. Because we're a hands-on operation, we knew we needed to focus our attention on how to get our company here ready to be able to produce. So we took a lot of recommendations. We brought in professionals, we brought in chiropractors, we brought in personal trainers, because we knew our employee force were going to be doing something different. So for example, our current employee force is used to working with really custom projects, and maybe they're moving around a lot or they're building something. Now they might be a little more sedentary and sitting and producing. So we wanted to make sure that they were comfortable, making sure their stations are ergonomically correct, making sure that we kind of produce things in a way to where a worker had to get up and grab their product in order to produce it. So everything was kind of streamlined. We were lucky enough to have a large location so we could do spatial distancing. We were able to split our shifts. So we have shifts that start at 4 and 5 in the morning, and we're here till 5, 6, 7 o'clock at night every day. So for us, it's been really difficult, but it's been rewarding. I can say that I'm very proud of the team that's here. I'm proud of all the partners that we work with, but and that's pretty much where we're at.
Great. Well, thanks, Scott. Jeff, Northern Light Health is a statewide health system and one of the largest employers in our state. Please walk us through some key elements.
Well, thank you, Dr. Gilkey, and it's a pleasure to be back on the screen again and chat with you all. Given the fact that I'm the last one out of the block here, you've heard obviously some common themes throughout, and I thought I'd just organize my quick remarks on sort of some lessons learned from our perspective as a large employer, as well as some moving forward remarks. So I'll start with just the basic context. We are a fairly large employer with over 12,000 employees across 125 or so locations here in the state of Maine. And as an essential service, of course, and like the manufacturing examples and some of the hands-on work that we've heard earlier this morning, we have staff, of course, who take care of patients. And so that in and of itself was a critically important challenge for us to make sure we kept them safe. But we also have about 40 to 60% of our workforce that are in these supportive roles. And as a result, we had to manage and still continue to manage those that we've moved into work from home and other kinds of settings to support this effort. So the first thing I learned, I think, and we all probably can relate to this as owners and leaders, it's certainly a lot easier to shut down operations than to start them and get things back up and going. No doubt, under these circumstances, restarting our businesses with all of the different precautions has lend themselves, as we've all heard, to some significant challenges. So we're no exception. Although we are familiar with managing and working in infection-prone environments as healthcare workers, it's certainly this is a step up from the standpoint of its significance, and so we're still. We go through the same challenges, I think, as all of our other colleagues on the phone. Our decision-making process, I thought, was crucial for us, certainly during the early stages, as leaders and again as owners, to be clear and decisive but adaptable. And we were fortunate to have a fairly well-exercised incident command structure. So we used that to its optimal to ensure that we had clear and timely decision making on how we're going to be responding to this. Working from remote, like we've heard with the bank and we've heard with the others, also represented some challenges because we also foster great teamwork, and we still do, of course, certainly with our clinical teams, but also with our support teams as well. But we certainly had a need to strengthen our technology platform, as much of our information also needs to be protected as well. So we had to make some immediate and quick investments in supporting some improvements in our technology platform to support our work from home staff. What was interesting and was mentioned, I think, with Ryan and at the Bangor Savings is, it's not that easy, or maybe it was Tasha, that it's not easy to think about how do we continue to ensure we've got the contribution and the productivity of our staff from home. So we've been working through that, and we've challenged ourselves and found actually some really good ways in which we can ensure that our staff continue to support and remain productive from their other locations. And in some respects, the Zoom technology and the platform actually can make people a little more productive and focused rather than the distractions you might get into every day. And also, in some respects, in some of the staff, there's no time clock anymore. It's kind of like email. We kind of do it at all kinds of day and night. So that was an interesting learning. We did declare, like a few others, there'd be no layoffs up front. We certainly understand the economic consequences and implications of that, and we're certainly living through that. But we did have folks who voluntarily exercised the furlough. But right off the bat, like others we've heard, it did provide some significant security, and the morale implications were really very helpful. We also needed to also be prepared for surges of patients, and we did do some redeployment of staff around. So we were not interested in shortchanging our mission of caring for the communities that we care for. So anyhow, that was a really important lesson learned. Reassuring and demonstrating through our actions that safety of our staff, and then subsequently, of course, our patients, is paramount. Can't say enough about how important that is and continues to be. We felt with our multiple locations that being consistent in our policies and our procedures and across the state, even though there's some different prevalence of virus in certain markets, but our visitor policies and our masking policies, et cetera, we thought it was really important to coordinate all that and ensure that we were doing it in a consistent fashion, simply for the public's confidence in us. Also, as heard, daycare challenges and the psychological barriers and the psychology of this all has represented, from a staff standpoint, some of the most significant challenges for us, as you can well imagine, as we've heard. And lastly, interesting lesson learned on the face coverings. although many of our clinical staff are fairly comfortable with that, our non-clinical staff have never been comfortable or even needed to, don face masks. We found that by, of course, requiring that as part of their return to work, it was viewed as kind of weird and uncomfortable and awkward, and so it's become increasingly acceptable. And I would say it's probably like seat belts from many decades ago. Folks didn't want to necessarily wear them, found them constraining, but we're getting there. It's not perfect, but we're getting there. I think going forward, I would continue to support the thoughtful policy development, being aware and sensitive to all of the different concerns that we have now certainly heard and felt during this process. So thoughtful policy development to me is really important. Can't say enough about securing sufficient PPE and the innovative ways in which companies have helped us. Intention, we can't say enough. They were a godsend for us to help support our PPE. We can't, again, thank you enough for, transitioning your company to help support us in the healthcare industry here. Cleaning supplies, all that stuff. We've heard, examples of that. Continuing to maintain awareness of what's coming down the pike. We've talked about ever changing, and so yes, ever changing, and we've had to adapt and adjust. It's not easy clinically when they're when they sort of dictate how we take care of our patients, but we have our expertise, thankfully, in our own camp here with our clinical experts to help us guide us through that. Of course, determining our financial strategies remains a paramount concern and issue. We're very thankful for the CARES Act funds that have flowed to us at Northern Light and throughout the whole healthcare industry. It is certainly not sufficient to cover what the losses that we've experienced, but we're very thankful for the cash flow, et cetera. Maintaining flexibility, can't say enough about that. And I also would like to really provide a special emphasis on the community partnerships that we have built and how critically important they've been and will continue to be as we go forward. And finally, listening to our people, listening to our patients, and communicating through any and all mediums that you possibly can absolutely is essential for going forward. So with that, look forward to the exchanging of questions and answers. Dr. Gilkey.
Great. Thanks, Jeff. Well, as you can see with the introduction to our panelists, I think we'll be able to field most of the questions that you could come up with, so feel free to send away. We'll focus on the questions now. What I will do is group similar questions together so we can address as many questions as possible today. The first question is for each of our panelists. What is one of the important lessons learned for you and your business during the pandemic? Carrie, we'll start with you.
For us, it was the shifts that we kept on saying that we couldn't do shifts. And, prior to that, we've talked about trying to put some of our technicians on shifts or our sales staff on shifts, different departments and shifts. And I would say that was one thing that we learned really quick is that, yes, we can do it. So, and we can make it through it. So that was a big one for us. And then working from home. That was a little bit of a challenge in some aspects. We have our call center that had no problem transitioning to working at home. Our accounting department and our warranty department had more difficulties transitioning from working from home. And I think the lesson that we learned there was that if we had scanning already done in our system, it would have made those two departments a lot easier in the transition. So we've already started and purchased the software in order to do all the scanning now. So for the future that we can actually, if we have to do this again, that we would have the systems in place so that it was a lot easier. But we have a lot of paper in our business. And so that was one thing that we've learned, that we'll actually get some space back once we get all the scanning done.
So when you talk about scanning, is that scanning also the ability for remote workers to do?
Well, it's more that when paperwork is done or that we can move stuff more online. So like our repair orders are on paper still. A lot of invoices are still, a lot of the car deals are still all on paper. So if we got those scanned in, or if we can change them over into electronic forms so that they don't have to get scanned in, is the big thing that we're trying to work for the future, because that would have made those two departments a lot easier to stay at home. That was a big one. And I would say the PP loan, For the Anthony Johns, I would say I was with a bank. I'm not going to name the bank. It was not the bank that's on. It's not Bangor Savings, so I'll give you that. I filled it out, and it was wait, and my gut was like, something's gonna get. I got to do something different. And I lucky that I had a good relationship with another bank that I was able to, the next day, get the PPP loan. But I had the application in the day one, and it took forever to get that. And for a small business, it was a big deal to get the PPP loan. So
great. Well, Ryan, as you can see, there is a good bank relationship that Carrie has already, so it will be an uphill battle for you. But if you would share a couple of lessons learned with us.
Yeah, really, we learned quickly the importance of clear, consistent, and constant communication for your employees. I mentioned that earlier, but I can't stress that enough. As mentioned, we started with weekly check-ins with managers, weekly CEO calls. Those evolved into daily check-ins with the employees and CEO calls twice a week. We also established an internal online COVID resource center. If we all remember at the start, there was so many questions. Do masks work? Do they not? Are face shields an acceptable replacement? And instead of having our employees get information from all over these places and often unreliable sites, we had an online COVID resource center, with the latest from the Maine and federal CDC and, reputable places, just a one place where they could go every day to be well informed with the latest information. We also sent a bank-wide employee survey, simply asking, what can we do to better support you throughout this pandemic? And their responses were anything from a more comfortable chair at home to, assistance with daycare. So that survey was really helpful for us. We regularly updated our social media channels to keep our customers informed. When you're closing branches and lobbies and hours and days operating are shifting all the time, our customers need to know. So that was very important. So I guess just in summary, the most important thing we learned is that if you think you're communicating too much, you're still probably not communicating enough.
Well stated. Jeff, a lesson learned. You're on mute.
I'm sorry. This is a tough one because I would say the lessons learned, one of the biggest lessons learned, and we're not used to this, is we sometimes didn't know the answer. And as a clinically oriented enterprise, that's never a comfortable place to be in. And we needed to be more honest and more transparent and be willing to say, we just don't know right now, but this is the best we have to work with. We're doing as much as we can, but we just don't know. And I think that opened up the need for ensuring that we tried really hard to develop a source of truth, where the right information that we could rely on and feel comfortable with, despite all the distractions that we heard in the media. But I think it was really coming to grips with the fact that during this unfolding of this virus, there still remains things we just don't know. And so we're doing the best we can.
Thanks, Jeff. So Tasha, if you would share lessons learned with us.
We have a long list, but if I'm going to choose one, it's that we were not leveraging technology well. We were forced to make a giant decade leap into we had Microsoft Teams. We weren't even scratching the surface of what we could do with it. And for people who aren't familiar, Teams is a lot like Zoom. We're kind of a face-to-face handshake kind of company. And all of a sudden you can't be face-to-face and shaking hands. And so, but we discovered there's a lot we can do with what we had. And so that was probably one of the larger lessons. There's a long list. I can't imagine everybody. So
yeah.
we'll leave it at that.
We'll have to collectively write a book titled "Lessons Learned in the Pandemic."
I think we could, and we probably all every one of us, I'm sure, has learned the communications. Even when there's nothing to communicate, people still wanted to hear. Nothing's changed, right? So
yeah, well, that's good news actually at times.
Well,
great.
Yeah.
Great. Well, thanks, Tasha. Scott, if you would share a lesson learned.
Yes, for us, I would say it would definitely be being fluid, being able to transition. As discussed earlier, when your industry's kind of slowed down, you have to be able to develop into something new, and you have to rely on not only the people within, you have to rely on the people outside. The first thing I did was start talking to other businesses. I talked to my bank, I talked to my bankers. I was really upfront with where my fears were, where my concerns were, what things I felt great about. And so what I did was I kind of, or we did, we took the company and we said, okay, what are we going to do? And once we kind of knew that we could help out with PPE and start a new medical division, we then instantly started getting our employees on board. And so I would say early and constant communication, and not just for the employees, but as at the admin level, when you have responsibilities to be making decisions for your employees, it helped me to know that I could communicate with them, so I wasn't holding things back. Or, you know, so if I was constantly updating them with what I knew, collectively, I could kind of get a feel that they were okay and they were going to be there for us. And so I would probably say, as a company, being fluid, and then communication the whole way around.
Yeah, that sounds like a really important theme. Well, I'll invite all of our panelists to go on video at this point to join us for a roundtable discussion. And the first thing that comes up is childcare is a big issue. I'm going to start with Carrie and then move on to Ryan. What has your company done in this regard? And you may include, did you consider having an in-house capability for childcare? So Carrie?
Yeah, childcare is definitely a big challenge, especially at the spa side, because at that side I have 70% of them all are have children, young children. So we are kind of right now on hold at on that side, just because we're waiting to find out what the schools are doing, and they're just starting to come out right now. Whether some of them are going back full, some are still going 2 days. There's one school I think that's doing 4 hours and for 2 days a week. So we're just trying to be flexible. We've considered maybe opening up on Sunday and Monday as a way. We're closed currently those 2 days, shortening our hours a little bit and making it so that we can accommodate them for their schedules, and being able to get, do services on clients. So that we're still working with. On the Darlings side, we've been working a little bit with Eastern Maine Community College, and maybe some of the other, like I call it Cardio Row, where we can maybe pool together and try to figure out how to utilize some of the resources in the area with childcare. We've been communication with the Y quite a bit as well. I know the Y is trying to do a lot right now. They're trying to gain extra space, and so they can actually house more children or take care of more children and keep the spacing going on right now. So it's still a fluent issue right now. I think that's just because a lot of people don't know what they have and not have, and then we'll be dealing with what we can do. And anywhere we can keep people working from home, it's been helpful. So we'll continue that goal. But from the rest of it, it's just a challenge. It really is. So hope to hear some good ideas.
Yeah, it's definitely a challenge. I mean, I would say that's probably 60% of my HR team's day these days is, fielding calls about childcare issues. So for us, what we did at the start, so again, we sent 650 employees home back on March 18th. So for those 650, throughout the summer, childcare wasn't an issue because they're working from home. But for the other 400 plus that had to come into the office, we implemented what we call thank you pay. So some companies call it hazard pay, but that sounded a little too scary for us. So we called it thank you pay. And essentially it was for all hourly workers. We gave them time and a half pay for all hours worked on site, and stressing that extra, cash flow could help pay for daycare since they wouldn't be home. For all salaried employees, we gave them an extra $50 a day that they worked in the office to help with childcare. So money obviously doesn't fix everything because there's still such a lack of childcare out there. Now with the Y and certain other places opening up, I think more of our folks have that access to childcare, but really it all boils down to what are the schools going to be doing. So as those announcements started coming out, I sort of wish New England or the state would have had like a standardized return to school schedule. I know that's not possible, but every school district is different. So some employees lack childcare every Monday, Wednesday, others maybe every Tuesday, Thursday, Friday. So it's just about being fluid, being flexible, allowing those folks that can work from home to continue to work from home. Be there to listen when they reach out and say, hey, do you have any ideas for childcare? So it's just kind of looking at each situation individually, trying to do the best you can for each employee and being as flexible as you can with each employee.
Great, Ryan. That's very helpful. Childcare is such an important issue these days, and I think we can't escape that it's tied to the school decisions. So I'll invite any one of our panelists to speak up on where do you see things with that combination of school opening, not opening, the discussions going on, which, from what I understand, can be fairly heated these days, along with the need for childcare. And for some of us, the hybrid model, a couple days in the office, couple days at home, trying to educate your kids throughout while they're staying home becomes almost impossible. So anyone who has an insight to that, please speak up now. No solutions, huh?
Well, this is Jeff, and that's of course a hot potato item.
Yeah, it sure is. It
But
sure is.
in terms of the science of it all, adhering to the fundamentals, social distancing and masking and good hand hygiene, those are proven. Those are true factual measures by which we can continue to contain this virus. So whatever methods and approaches and whatever, they've got to adhere to those three principles.
Mm. So I guess getting back to the basics and really paying attention to the science as it's evolving, might be good advice. I asked that question very purposefully because I think many in our audience probably share that same dynamic tension going on between, childcare, school, return to work, remote. So thanks, Jeff. Actually, the next question is for you, Jeff, as well. And Scott, you may want to weigh in on this, and others too, depending on what your circumstances are. So I'll read this to you. We are hearing a lot about indoor air quality concerns, particularly as the weather turns cold and we have less fresh air naturally entering our workplaces. This, coupled with the reality that some are refusing to wear masks indoors, or do not understand that universal masking requires masks indoors at all times. What is Northern Light Health and others looking at now to ensure safety? So Jeff, if you get us started, and I welcome our other panelists to weigh in as well.
Sure. This is a tough one. This is not an easy one, especially with all the locations we have. Of course, fresh air, outdoor, that's the the ideal. But we know we are dealing with varying ages of HVAC systems, et cetera, and air exchanges. And so therefore it's a one at a time kind of assessment. We have to evaluate each and every physical location, do our best to, if we can goose up the air exchanges, of course, we do that. We still have more to go. But we also must augment that with all of the other principles of social distancing and the barriers, et cetera, et cetera. So there's no easy solution to that one.
So Scott, is that something that you guys had to deal with as well?
Yes. So currently right now we are fully PPE. While we're at work, everybody's wearing PPE. So we're wearing gloves, we're wearing gowns, we're wearing masks. But one of the things we had to start looking into was we have quite an efficient HVAC system, but we are investing into further equipment that will filter out air, process air in without losing the elements that you've paid for, whether it be cooling or heating. So we are looking into that. It's quite extensive, but I think it's also important that there's small things you can do as well. So we have the spacing there. We are lucky that we do have the amount of space, We try to offset our shifts so that way we're not on top of each other. We've also done some things that I think speak well to what our administrative level decided to do, which is we try to provide luncheons inside, but we space everything out so our teams aren't going out into, say, the restaurants and the stores. So we're trying to, keep them where their lunches and their snacks are satisfied here. Those are some things we've been able to do. But yes, without a doubt, we are investing into an HVAC technology that filters air.
Great. Well, thanks. Tasha, a question for you. So what positive changes will continue after the pandemic? I think you caught my attention with technology before.
Well, we've implemented a podcast that we do every week, and we found that that's a great way to create camaraderie and communication with the field. So we've been leveraging that. We've been leveraging a texting application so we can quickly hit everybody with a text when we want to communicate fast info. We didn't have anything like that. We're using Microsoft Teams, which is equivalent of Zooms, for all kinds of things now that we were not using before. A lot more meetings. Interestingly, even though many of our people are back in the office now, we're continuing to do our meetings via Teams so that we're not crowded into one conference room. And it's really allowed us to also take those Teams meetings out to people on the job sites, which is just something that we really hadn't done before. So we're having monthly safety stand downs where they can all join from the tailgate of a pickup truck with an iPad and see our president. And that was just something we weren't leveraging, but it had been there prior to going through the pandemic and the shutdowns. Everybody now has a scanner. We do a lot with paper. We've switched to DocuSign as opposed to wet signatures on everything. We've really just taken advantage of a lot of things that were already there. We just weren't that motivated, I guess, to change. So it's been very good for us as a company to have to adapt in that regard. We're far more flexible, far more nimble. A lot of our people had desktops. We're going to go to a policy where now everybody has a laptop. And we had to scramble just to get webcams. So we were definitely behind the 8 ball.
So it sounds like quite a bit is going to stick for you guys.
A lot. We would drive 2 hours for a half an hour meeting. And some project managers have said, it's great to be face to face, but if you have really good technology and instead you can save that 4 hours of drive time to be productive, we want to rethink some of these things.
Well, I'll make a final point to connect with that. As you can see, I'm today in my office. I think Jeff is too. I recognize your office over there, Jeff. And we've been using a hybrid model where we work from home as well as we work from the office. And one thing that I could say, and I didn't think this would be as impactful as I thought, that face-to-face connection, albeit with masks, so you don't get to have the complete facial expression, with my coworkers, including the president I report to, my boss, really is invaluable. I can't emphasize that enough. I mean, the Zoom has been great. What we're doing right now is terrific. It keeps us all safe and communicating, but there is more to the story for sure. So with that, I'm going to ask, let's see, another question came up here. So let me just try to grab that before we switch gears here. So I'll ask the question first, and then I'll identify who should answer it. Sorry for that. Knowing how dangerous it is to have anyone enter your business without a mask, what do the owners do to address those that refuse to mask? So let's see. That might actually occur, probably Carrie, yours more than any, and your smile is a giveaway. So if you would try to answer that for us. Oh, you're on mute. You're on mute. Okay,
yeah, there you go.
Great, thanks.
That has definitely been a challenge for us in both locations. And what we've done from the spa side, there's a bunch of questions before the client comes in. We ask, and if there's a situation where we have somebody that can't wear a mask, and there are people that actually can't wear masks for certain health reasons and stuff like that. So what we've done is we'll accommodate, and we have a private room. We'll do it during a time that we'll reschedule it to our time, and also with a provider that will doesn't have a problem, but that provider will be more geared up than even more geared up, I would say. So we try to accommodate some of the people that way. From Darlings, it's been a little bit of it's been a challenge. We aren't at the size that is mandated where we have to enforce it to completely, but it is a challenge because we've had customers complain of other customers more than our staff is at least all PPP. We've all done, we have got the mask, plexiglass is everywhere in our businesses, distance markings and signs and everything like that. And so it's a case by case basis, but we really try to try to accommodate the customer as best we can. If we can try to get that so that's a drop off, or any way that we have outside waiting areas and things like that. So we'll try to gently encourage them, but we don't really have a big problem with it. We've had a couple at the very beginning, but I think we've been able to handle them pretty easily.
Awesome.
But, yeah. Yep.
Awesome. Thanks, Carrie. So as you all can see, we're winding down here. I have at least an hour's worth more questions to ask all of you. And this really is really enjoyable to get everybody's perspective. But I'm going to go around the horn, recognizing that we have to keep our answers to about 30 seconds. I'll ask you all a final question. I am confident that each of you has an optimist within. Please share something that happened during this pandemic, big or small, that personally gave you hope for the future. I'll start off, Scott, if you would. You'll need to.
Without a doubt, it would be working locally. So often in our business before, we were working out of state, out of country, different regions of the area because of the types of industries we are in. And being able to kind of re-engage and get to know all these companies locally has been by far the best for me.
Awesome. Excellent. Tasha, if you could share with us, what gives you hope?
Well, our camaraderie and morale has never been higher. It seems that our people are thankful. They were very thankful to be able to keep working. It's kind of a shoulder to shoulder, we're all in this together mentality. And we're having a great year. So we're just very thankful.
Excellent.
Very thankful.
Awesome. That's excellent. Ryan.
Yeah, probably there's a ton of things obviously that make me optimistic about the future, but probably the most important is the way our employees and frankly our communities have all stepped up and come together during this pandemic and really proven they'll do anything they can to support each other and help each other get through this. We've had employees reach out and say, if you need help with childcare, I know someone. Or if you just need someone to talk to, here I am. We've had departments that maybe weren't quite as busy raise their hand and say, you know what, if the folks over doing the PPP loans need some help, because I know they're crazy busy, I'm willing to help. So everyone's truly stepped up and just proven they'll do anything they can to help each other. And
that's totally awesome. Yeah. That is awesome. I have to say, thinking about what goes on the evening news and on the various stations on the evening news, I can't help but think that given a chance, people can be amazing. And we see it every day right around us. So thanks for that, Ryan. Carrie, what makes you hopeful?
Well, for me, one thing about living in Maine is that people are resilient. We are a very strong community and we're very connected. So I think that to me has always been optimism here, because we just we'll get through this. We will definitely get through it. People are pulled together. I know that the next big hurdle besides after childcare will be the charities. I think that's going to be the next big thing, is helping out a lot of the nonprofits and trying to get them through it. So, and I know that this community will definitely stand up for that and help out with that.
Awesome. Awesome. Jeff, your 30 seconds or 20 seconds?
I think we have a thematic royal flush here, because my observations are the same. The resiliency, the commitment, the resolve, the dedication. I have just been blown away at just how the staff of Northern Light Health have come together, and I think it bodes well, not only for our enterprise here, but for the communities that we serve. It's just been fantastic, remarkable. I can't say enough about our staff at this Northern Light Health. Terrific.
Excellent, excellent. Well, thank you, panelists. On behalf of Northern Light Health and our audience, we are very grateful for the time and experience you shared with all of us today. You've truly made a difference. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. We hope you have found the last hour a good use of your time and you were able to identify some useful tips to apply to your business. Next week, and I have to warn you, I'm excited about this, we'll have an insider look at what happens when outbreak occurs. What do you do? How does your business recover? We'll bring together people who have experienced an outbreak here in Maine. You can't be better prepared than to know what our panelists know. Hope you can join us. We will send you the link along with the topics for August 20th. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine be safely open for business. Thank you and have a good afternoon.
Thank you.
Thank you. Bye.
Thank you, everyone.
Thanks, everyone.